This is Dr. Gaurav Chopde. I am a gynec laparoscopic surgeon and an infertility specialist practicing in Pune. This is March end is the endometriosis awareness month, where I am here to make you all aware what endometriosis is and what are its implications in the life of a woman. Now, endometriosis, you basically should know what basically endometriosis is and why the incidence of endometriosis is rising. In my day-to-day practice, I basically find most of the females are not aware what endometriosis is. So basically endometriosis is implantation of active endometriotic tissue at places other than its normal place, which is the endometrial cavity. If the endometrium is from here, it goes to some other place other than this endometrial cavity, then it is called as endometriosis. It can go anywhere, say at the posterior surface of the uterus, which is most common site, which is called as pouch of Douglas. It can be ovaries, which is called as which if they're over here, it will be called as chocolate cyst of the ovary or ovarian endometriosis. It can go to the urinary bladder, where it is called as bladder endometriosis. It can go to the bowel and to the rectum, called as bowel endometriosis. So basically it has widespread implications. Is anything endometriosis to be afraid of? Never, but awareness is very important. It affects all age groups of patients, right from unmarried in the teenage group to the married age and in the perimenopausal age group. That is, if you go in the teenage group from 15 to 20 years, basically these patients presents with severe dysmenorrhea. Dysmenorrhea is painful periods. And why does this occur? The endometriotic implants specifically become active by sending some chemicals which causes spasm in the uterine muscles and causes spasmodic dysmenorrhea. Now, this type of dysmenorrhea is very painful. The life of the female becomes very difficult during the periods, and she feels that she cannot do any work during this type of menstrual cramps or dysmenorrhea, or during these 2-3 periods she is not able to do her routine activities. Now, this typically pain starts at the onset of, before she gets even the periods, the pain starts. It is maximum at the onset of the menses and disappears as the menses completely disappears. This is characteristic pain of endometriosis. Now, how do we diagnose this endometriosis during the time of this dysmenorrhea? So patient should have an ultrasound and visit her gynecologist for the clinical symptoms. Treatment is very simple. Initially it will be an ultrasound. Second, we can give her simple painkiller medication like NSAIDs, and then symptomatic treatment is more than enough. But at this time, the endometriosis should not be overlooked. We should do a detailed laparoscopy to know what grade the endometriosis is and treat it accordingly. Then second age group it affects is around 25 to 35 years of age group, which are married women. These women basically are having just dysmenorrhea or sometimes chronic pelvic pain, and the most common symptom which they present to us is just infertility. Now, how endometriosis causes infertility is very important and we should know. Endometriosis causes first dysmenorrhea, second it reduces the quality of your eggs, third it affects the endometrium also, fourth it can cause dyspareunia, that is painful menses also, right? And at this stage also the diagnosis is again by clinical symptoms, second ultrasound, and third even laparoscopy for staging and treating also. Now, other stage which it can affect is the perimenopausal age group, that is when the periods are about to go, right from 45 to 50 years of age group, where the presentation is just for menorrhagia, dysmenorrhea and these chocolate cysts. Here again the treatment is symptomatic. 1, 2, it can be giving medications, and third it can be a laparoscopic surgery. So according to me, the most important is diagnosis, how it is diagnosed, and people should know what endometriosis is and whom should be treating it. So in this endometriosis awareness month, I think all of us should know the characteristic features of endometriosis and the use of laparoscopy for diagnosis of endometriosis, right? So I would request all the female who are suffering from these problems to visit the obstetrician gynecologist or the laparoscopic surgeon for the diagnosis and treatment of endometriosis to make their life better. Thank you.